I'd like to introduce our distinguished speaker today, Soto, a colleague and dear friend of mine. We work together on the Consortium for Healthier Miami-Dade. However, she has a much more prominent role. She's the chair of the Consortium, and she's also the chair of the Children's Issues Committee. In addition to that, in 2016, she represented Miami-Dade County as recipient of Robert Wood Johnson's Foundation for Culture of Health for the prize. She also serves on a number of committees across Florida and is a voice for early intervention in health, disease prevention, and well-being of children. In addition to being a community advocate in her spare time, she is the statewide quality liaison for the Florida Department of Children and Families Office of Child Care Regulation and Background Screening. Currently serving more than 8,000 licensed child care providers, Ms. Soto works with child care directors, teachers, families, community stakeholders in the areas of mental health and disease prevention throughout the state of Florida. So welcome, my dear friend.
Thank you, Dr. Natali. Good afternoon. Thanks for being here. I'm excited to talk about the Consortium for Healthier Miami-Dade. We'll just move to the next one. So the Consortium for Healthier Miami-Dade, we're going to talk a little bit about who we are. Well, you've just heard about me. Statewide Quality Liaison for the Department of Children and Families in the Child Care Program Office. Did you know that there was a Child Care Program Office? Yeah, well, you do. Yeah, you would, Doctor. So someone has to manage our child care programs in the state. We're lucky enough to have a robust group of individuals outside of the CPI domain. This is people who sit and work with our child care providers at all levels, because we have all this spectrum of providers, and help them run their business, meet regs, provide the proper care and resources for our children in our child care center. We have about 250 employees across the state who just do that. They're assigned centers. The centers are reviewed on a regular schedule, and we give them technical assistance and try to help them to do the best they can. We also provide them with resources when they find themselves in need of special care or even business support, all sorts of things. We're trying to create a real positive relationship with them so that they can rely on us. Rather than feeling like we're regulators, we want them to feel like we're their partners. So the Consortium for Healthier Miami-Dade was the vision of a now retired Dr. Lillian Rivera, who was the director of the department here in Miami-Dade County about 16, 17 years ago. She had the vision that we can't do it all alone. We can't be in silos. It has to take literally the village to create a healthy environment, healthy community, and provide the services collectively. So her vision was to create a healthy environment, healthy lifestyles, and healthy community. We're going to talk about what that looks like. And our mission is to be that catalyst, and the catalyst is a word, the impetus or the platform or the common ground or the place where people gather to support and strengthen policies, systems, and environments. I know that you know the importance of policy systems and changes in environments, but it's part of our function to communicate the need for that and what that looks like in the community. So it's part of what we do. You know, those grants require you to make those changes. So as far as goals for the consortium, Dr. Natali and I were talking about integrating planning and assessment processes. The Department of Health has just, I'm probably their biggest fan. I carry around my little pom-poms. We're very lucky in Miami-Dade County that this Department of Health specifically really cares about what people think and what people need. So on a regular basis, we go out I don't work for them, but I am a partner. We go out into the community and talk to the community and ask questions. The assessments and the evaluations based on, and I'm going to explain CHIP, you're going to hear all the acronyms, based on a state health improvement plan, which is done obviously at the level of Tallahassee and that leadership. That is then funneled, that comes from Healthy People 2020. That then funnels down into individual communities. Obviously, counties have different needs, and so they're flexible enough, if you will, to let the community make those decisions. We then get the chip locally, the community health improvement plan, and we go out into the community. We have gatherings, and that's something that I would like for you to consider doing when we talk a little bit more about it. We actually go out into the community and say, hey, doctor, what do you think? What are you seeing? What do you need? Here's what we're focusing on. What does that look like in Miami-Dade County? And we don't just do it with the doctors. We do it with the individuals in the community. We want to talk to the end user, to the person in need, to the community in need, to people that are far away from this level of conversation, so that we can piece this together and create the right goals. Healthy weight. Dr. Natalia and I have been doing this for a long time. We were blessed enough to work on the Let's Move initiative, our own CDC initiative, and I'll tell you a little bit more about that in a little bit. And the harder we paddle, the longer the distance seems to become. It's just an endless battle, but we are working diligently and want partners and want to continue to work, because this is part of who we are. That healthy weight is just going to be part of the health of this community. And so you'll see when you look at the committee what some of those initiatives are. Revitalizing community. Such a great place to live. We live in one of the most beautiful places in the world. So we need to revitalize our communities. We need to start walking. We need to do the things that you all know are important, but how do we communicate that? And that's part of what we're going to talk about today. And increase the access to resources. It's all about, can I get access to care? Can I get access to walking space? Can I get access to safe neighborhoods? Can I get access to clean water and reasonably good food? So that's part of what our focus is. The other way. Okay, the committees. Each committee has a chair and a vice chair, and we all serve under the executive board. This is really the outline of where we focus. We had to put some sort of structure together, right? It couldn't just be everywhere. So we started to prioritize what areas, or how do we create groupthink around the issues that we're talking about, that we find we need help in the community. So near and dear to our heart is the Children's Issues Committee, which is anything and everything having to do with children. We started focused on 0 to 5. Then we realized that's pretty unfair. We need to expand that conversation. So we welcome everyone to the table and really look at 0 to 18. It's kind of our focus. Then we had an oral health committee, but it sort of lived out here by itself. And we thought, well, what do they say in oral health? Without oral health, there is no health. So we combined and brought in the oral health committee to make it one under us. That includes working with partners like Colgate, who go out into the community with their van. They have free screenings. They're available for community events. We work with local dental groups, work with local training, getting these resources out to communities. We had a little, they were at a fair down in Homestead, and there was a little boy who came in to be screened, and his condition was so bad that they took him from there to the hospital. A child who worked, whose parents worked in the fields, in the migrant community. So that's, for us, while we wish we didn't have to do it, that's the kind of work that we do. The children's issues, the health in the built environment. So what does the built environment have to do with health? Somebody tell me? The built environment, what does this have to do with health? Forget that it's a university and a hospital. What does a building have to do with health?
Bringing resources to that community.
Bringing resources to that community.
Information and access to the care.
Okay. What else? Well, hi. Another part.
It facilitates how people communicate.
Facilitates how people communicate. Okay. What about green space? What about healthy buildings? about creating communities a la Brickle, right? Where the universe just lives, your entire universe is within that. There are pros and cons, I guess, to that. But creating built environments that are health focused and accessible for people. So health and the built environment includes your great Joanna Lombard, who is an amazing architect, and she thinks about going forward and building. What are we doing with this space? How are people moving? Is it green? Is it healthy? By the way, you're a developer. These are the things you need to do to make your project a healthy project. Obviously, we're talking about, climate change and tide rise, and that's a political hot potato, but nonetheless extremely unnecessary conversation. So those are some of the things that committee works on. And I'm telling you about these committees because I'd like for you to find, my goal here is for you to be excited about the consortium and find a home in some of those, in any or many of them.
Something I want.
Yeah,
Does
Dr. Natali.
each committee meets every month, like the children's issues? Or do
Not
they-
all of them meet.
Okay.
Some meet every other month, right? Health in the Built Environment meets every other month. And the chair is an amazing young lady who is who works for Miami Architect Academy. And I forgot CAD, I don't know the acronym. Health promotion and disease prevention. Well, that's right up your alley, isn't it? So, for example, in that committee, they worked on a grant that we were working on as well, where they went into local restaurants and said, we have nutritionists, we have chefs, let's look at your menu. We're going to offer you 5 items, 500 calories or less. And they designed the menus, they designed the recipes, and they put these in place in over 500 restaurants. So things like walking into a restaurant and saying, and by the way, non-chain restaurants, I'm not talking about the typical chains. Walking in and saying, why aren't you offering healthy options? Why are your calories 2,000 calories for lunch or 5,000 calories for dinner? So that's part of the information, and they just never thought of it. So it was win-win. That's part of what health promotion and disease prevention does. Right now, they're tracking steps. Well, it's a community. We want people to walk. We want to find initiatives and motivation for people to walk in the community. That's an example of what they do. Marketing and membership. That's about getting the word out, increasing membership, finding partners in the community to join us, to continue the mission globally. Again, the greater the membership, the greater our reach is our expectation, our hope for that. Elder issues. Yeah, a whole lot of work being done in elder issues. Such an important part of this community for sure, and the state of Florida. But in elder issues, we're talking about relationships at 60, 70, 80. Talking about things that maybe necessarily are not talked about often or might not be comfortable for that generation to discuss. How do you stay healthy? How do you get out of your home? What are you doing? Initiatives where we encourage people, make things available. Transportation is a huge issue in elder affairs. Getting around after they take that key away from you is really tough. And sometimes there's not that kind of access to transportation at that age. So relationship building and getting them out and creating projects where they can be other than in their home, trying to get them to move around. So that's the Elder Issues Committee. Tobacco-free work group, well, isn't that timely? We got Tobacco 21 last year, and finally, you have to be 21 to purchase a tobacco product. That was a major battle, and certainly it wasn't us, but we were part of that team. It's around education, it's around tobacco cessation, and it's very heavily focused now on e-cigarettes and those products. And so our focus is educate our legislators, find a way to find things that matter to them, that make a difference, because it's not all about the green. It's about how do we save our children. And so in Miami-Dade County, we're really lucky as well to partner with Miami-Dade County Public Schools. Our superintendent is amazing, and he's very proactive, very engaged, and it's an excellent partnership with the health department and the school district here in Miami. So education, cessation, information, they go out into the community and they talk to people in the community. So if you're serving a community or you're in a project, that education is available to you for free. The resources are free. So that's part of, again, the statewide health improvement plan. And we've incorporated and integrated it into our community health improvement plan. And then lastly, worksite wellness. Health in the built environment and worksite wellness are not necessarily the same. Because if you work at a place where you can't go outside and walk, and there's no incentive or initiative or program for you to maybe have a walking group, or let's take the stairs, or what are you doing for stress relief, or is there a place that nearby where you can get healthy food? Is it a safe location? So we work on with corporations, mental health as well, stress reduction, alternatives to smoking and unhealthy behaviors, all that around worksite wellness in working with companies to help them provide better care for their employees. So those are the committees, and that's where I want you to find a home. So today it's about community engagement and your everyday practice in medicine, because actually the title of this chat is The Practice of Community. Community partnerships and funding opportunities. You're going to have to face that. That's really where we are. Very much a part of what you are going to face as you go forward. And how to see your work, what you do from the community's perspective. We want to look at, what does the community see me? What do I look like in the eye of the community, the eyes of our community? So understanding community engagement is a little bit about compassion and a little bit about clarity. You want to be clear about what you're thinking, what your intention is. Bringing your skills to the table without a lot of judgment, because some people don't know what they don't know, right? They might come in with a great idea. We've experienced that. I've experienced that. I had this great idea, boom, and then when I actually put it into motion, it's not exactly. So bringing your knowledge and experience and listening to what folks need when you're out in the community. Finding a home in the community, which is what the consortium is about. Feedback and analysis. We really just need to communicate better. That sounds like a really good idea, but it's not going to work because of this. How about if we try this? Putting yourself out there to engage other people and to help them as well. I think understanding community engagement is, you got to sort of let yourself go. What are you afraid of? Here's what I'm afraid of. Here's what my concerns are. How do we work on this project? How do we get this done? How do we execute this? With kind of an open mind and a consultative approach, right? Partners in each aspect, including the development of alternatives. Yeah, you've got to be flexible. It can't always be in that box. And some of us who work for government are really restricted to those boxes, and some of us who take government money are really restricted to those boxes. So we have to be careful about meeting our goals, but at the same time, try to push that envelope a little bit to help people, because you come to the table with an expertise or a passion or a direction, and maybe if you can make ends meet, you find each other. You meet somewhere, maybe not in the middle, maybe a quarter of the way, and that other entity comes 3/4 of the way. So it's about being flexible and being creative. You have an excellent example of that in Dr. Natali and her team. You know, you just have to bend a little, but being in community is really rewarding. And the final decisions everyone needs to own the final decisions. Working in community, people need to feel like they were part of that decision, like they have an impact, like they can own it. When you have that kind of collaboration, it's much easier to succeed when people own that. Their decision, and they're involved in it, and you're clear that they're engaged in it. It's a much more successful trajectory for you. It's an easier road. And making sure that you acknowledge, and again, I think Dr. Natali is really good at that, the importance of everyone's contribution. And not everyone will contribute the same. There will be times when you're out in the community where you do most of the lifting. And hopefully the next time in a partnership, another entity will do most of the lifting. So why is he there? You gotta kiss some frogs before you find your prince. Yeah. No matter how smart you are, no one succeeds in a silo. And so this is really the crux of what I think a huge benefit of participating in the community and with the consortium, and that is we have had some very successful partnerships at several million-dollar levels over time. We'll talk about a partnership that we had with Dr. Natali. So the SHIP, you're going to hear that when you're in health, State Health Improvement Program out of Tallahassee again. The CHIP is the Community Health Improvement Program. And one of the projects that Dr. Natali and I worked on was a project called Communities Putting Prevention to Work. Extremely successful, actually one of the reasons why we were awarded the Robert Wood Johnson Foundation Health Prize, because of the success of that project. And I'll tell you briefly what we did. There were several $1 million involved, and I think the county got 15 or $17 million to do to meet certain requirements. Dr. Natali and I were actively involved in the obesity prevention scheme at that time. Everyone was excited about that, and we were really getting a lot of community support. We took, at that time, Miami-Dade County had about 1,250 licensed child care providers. So our focus was strictly through the Children's Issues Committee, and it was strictly around educating child care providers and the families and the children. 0 to 5, man, you've got a captive audience. You start changing those habits at 0 to 5, your opportunities are exponentially greater. So we worked with 1,250 child care providers. It was a volunteer project, by the way. They didn't have to participate, but they were so hungry for that they came in droves. We had gymnasiums full of providers. We taught them how to use hula hoops, creative ways to exercise, cooking, nutrition, how to read a label, what to do with the kids. We had sessions with their families. And that was probably the most successful initiative in the state for communities putting prevention to work.
In a short period of time. It's
In a
only
very-
18 months.
We had 18 months. So we got the product together, started up, I had a team of 18. Started up a whole team, moved offices, did the whole thing. We did that later together, but this was a larger project. And in 18 months, we touched everyone. Everyone got the curriculum. We followed up with assessments. We followed up with technical assistance. And roughly 1,200 child care providers were trained. So it was a really hard work, but so great. Hard to put a word or two on the gratification of that project. And it certainly wasn't about making money, because we were not getting rich on that. But it was about the education and the benefits. And people still talk about it. And we still joke about water, and the fun things. And you would see grown men and women dancing and moving and jumping up and down and being kids, which is one of the things that we learn from this experience. We forget to kind of be the kids that we're serving. What does that feel like? How are you a child? So it was really very educational for us. Funders have a tendency to tell you what they want. And we've learned over time that it's not necessarily always doable. So how do you work with a funder and say, I get that, and let me explain that here's what we've done in the past, or maybe that's not going to work. So don't be afraid to tell your funder what you think. Obviously be nice, but give them your ideas and help them educate. Help them see why what their vision is may not be practical, because you'll both fail. And you don't want to do that, right? Or it certainly could possibly fail. Be yourself and be open. Funders need to know who you are. What your passion is. What you find difficult. What you disagree with. Respectfully disagree. So no one is set up and no one is disappointed, and next time there's a pot of money, they call you back. Be prepared to do the legwork, yeah. And that's just not the research piece. There's a lot that goes into it. We had tearful days on one of our projects because the more we dug, the deeper we dug, the more we realized that the things that they had asked for in the beginning wasn't exactly what we understood, and or they changed it down the road. So be really, Anna, I mean, yeah, Christina's nodding her head tearfully. We experienced that, but we did fine. I mean, we did fine. And your team, it starts with no one can live in a silo. If you don't have the right team, it's painful. So find like-minded spirits with like-minded goals. Not identical. Like-minded is good. And people you can work with. Because there is no time and no room for dissension. There's no time for confusion. Be consistent. Be consistent with the people that you work with. Be consistent with the clients that you serve. Be consistent with your funder. Always be you and honest. And you're going to have to accept that they hopefully will be honest with you. So it's a give and take. You may not like what they say or what their approach is. I mean, we have funders that it's all about them. And you just got to go, wow, yeah, but it's not. And sometimes you just have to turn the other cheek and accept the fact that if it doesn't have their name on it, they're not going to play in your sandbox. And you can't play in theirs. So we call it leave your egos and logos outside the door, which is really surprisingly hard to do and really surprisingly hard to find funders who are willing to do that. But if your goal is to serve community, that's really a good recipe for properly doing that. Okay. So how do you take the consortium goals and integrate them into your work out in the community? So the consortium, our goal is to increase membership. This is an opportunity for increasing membership, right? Dr. Natali has invited me here today. We're having this conversation. You're going to go somewhere and you're going to say, you know, I went to this consortium thing and there's this thing called consortium and they're doing XYZ, or go on the website and check it out. So increasing membership for us really means increasing reach. Doesn't cost anything. We don't charge anything for it. But our goal is to be out in the community and spread that net across the county. This is Miami-Dade County, but you know, we partner with people outside of the county too. The systems and environmental change. That's, by the way, when you look at that 42-page contract for your funder, these are the most important words you'll ever have. Policy, systems, and environmental change. That's what they pay for, essentially. Without that, I don't know too many grants that'll give you money for that, but maybe there are. So be clear about yours and theirs, what you can deliver. And we want that partnership where you can be out there. Well, look who is there. You can't come in quietly. You can't come in quietly. It's so good to see you. And our goal is to increase access to resources. And at the end of the day, I think that's what most of us are doing in our healthcare work. You bring to the table an innovative leader in your field who just walked in the door. Meeting our goals for healthier lifestyles and healthier community. So you see the integration, how easy that becomes a good marriage. Articulate clear goals. When we're talking about integrating them, I need to know what mine are so that you need to know mine and I need to know yours. And how do they match? Where do the twain meet? Sometimes that can be challenging because not everyone really is good at articulating their goals. They think, I know it's up here, but I'm not sure how I can do that. So when we go to the previous slide and talk about trust and good teams and building relationships, that's fundamental. Without that, it gets messy and no need for that if you're able to articulate your goals. So things like the partnerships with Dr. Natali, is this what we're really doing? Bounce it off people. Get suggestions from other people. Make sure that your goals are clear and keep that conversation throughout the entire project. Be a partner in change. A lot of young folk in the room. I'm not one of them. But you really are in an amazing institution. I've been working towards this, on this goal of enhancing this place for 30 years almost, including my own personal life of development for the hospital. This is an amazing place. They don't pay me to say this, but you are in an amazing, amazing institution, and we're very blessed to have this. So you are actually, by being here and learning here, potentially a partner in change wherever you go. I ask you to do that because this institution deserves you to do that for the community and pay it forward. That's what this community conversation is about. It's not all about the funding. It's about where you are and who you're talking with and what you're sharing and what you're learning, what you're bringing back. Because where you go and a thought and an inspiration might not fit what you're doing right now, but you're going to have lunch with someone and that person is going to tell you what they're doing. You go, wow, I just got that. I went somewhere. It's exchanging information and ideas, sharing what you learn. You know how like they send one person to the seminar and then that person comes back and reports? Except for that's what you do for your life. Wherever you go, you're gaining information and you're sharing it with other people. So paying it forward is, what can I do to help you? Whoever that you is, whether it's the you, or it's your friend to you, or a colleague, or just someone in the community. Because what we do is we're out in community talking and say, oh, you know, Ruby has some money, and you have some clients, and that has an organization. Let's put you all together. And that's what I mean when I talk about community. It's about putting those partnerships together, not all necessarily around money. Some of it can be services, some of it can be ideas. You can walk. You guys do a wonderful walk here every year. What is that? Which one is that? The big walk. Is it? I don't remember who it's for. So your community is your laboratory, is the conversation. Those chemicals, that chemistry that you have, the things that you learn. When you go into lab, what do? You're looking at what's going on. You're saying, well, what can I do? Where do I fit in that? You're setting an example. Because if I walk the walk, talk the talk, I better walk the walk. Which is really pretty rewarding, because that's what you did. Again, Dr. Natali really did it. That she's so healthy eater, she makes me nuts. I can't do this. See, let me read. What did I say to you when I saw you? It's 12 o'clock, she's going to have her green juice. Walk the walk. And I mean that, that's fun. But in delivering care and delivering services and sharing knowledge and sharing experiences, if you don't believe it, trust me, they're going to know. Whether that's your end user, your patient, your community-based organization, or your funder, or your boss, they're going to know. So believe it, and if you don't believe it, you might want to consider the possibility of doing something else. Because you can't do that. You can't be genuine if you don't believe in what you're doing, and you don't believe in delivering what it is you're promising to deliver. How do you listen to community? So you're out there. What do you do? How do you listen to community? Doctor, could you share? How do you listen to community? I don't mean to put you on the spot.
Well, the first thing that you have to do is open your ears.
What does that mean?
What it means is going in and not having a predetermined idea of what the outcome is going to be. It means asking questions and being open to hearing what people are going to tell you, not being defensive about it in any way, and not jumping over the top of them as they share that information with you. But then finding ways that you can connect with the information that you're being given.
Thank you. listening is probably the hardest thing we have to do. Because first of all, we all want to help, right? So I got a great idea. Well, wait, I haven't, you haven't heard me yet. And I say that in the me, but I'm also saying that in community. Oftentimes we've seen opportunities in communities where we come in with the prescription. And guess what? We don't exactly have the right chemistry. It's not exactly what we thought. But because we have the initials after our name and we spent half of our life in school and learning, we think we have the solution. You would be amazed at how many times we walk into community and we find that what we thought is not. Example, there was a project for nutrition education and recipes exchanging in cooking school. And they were doing it on Sunday afternoons. Well, this community doesn't. This community goes to church on Sunday afternoons, and then they go home and have supper with their family and their friends. It was a great idea, but nobody asked them. Nobody asked leadership in that community, "Hey, this is our idea. Will this work?" So, needless to say, they had to rearrange that project. So listening to who you serve is really important, and I mean that at a grassroots level. Are you approachable? You've got a lot of initials after your name. You've got a lot of credentials. You've got an important position in Tallahassee. Are you approachable? And just like the honesty and the integrity piece, if you're not, people see that. You can smile all you want. You can do all you want. But if you don't really mean it, and you're losing an opportunity if you become too restrained and too restricted. Because people, it's not about you. It's about maybe that individual or that group is afraid to approach you. Oh, I can't talk to doctor. I can't bother you. Or, it's just us. It's just our little project that we have. We can't. You're too big for us. And it's a waste of your skill and your ability and your uniqueness if you're not approachable in community at any level. Lots of doctors walking around who just say, "Hey, call me Patty." And they don't even say they're doctors because sometimes that's a little scary. That's like, "Oh, maybe I can't. Maybe you're too big for me." So while your intention is really good, I invite you to consider keeping that in mind going forward, being approachable. And what are you doing to develop your people skills? How many medical students do we have? Interns, medical students in the room? Okay. What do we have in the room?
Yeah, psychology interns.
Psych interns? Hello? Okay, good. In your training, and Dr. Natali, don't listen to this. In your training, how do they show you, what courses do you take on compassion? Is there a Compassion 101 in the curriculum? Right? Do they teach you how to speak with patients? Is there a community involvement 101? Is there how do I work in community 101? Yeah, no, right? And because there are lots of other really important things you have to learn. So not that what you're learning isn't important. My point is, what are you doing as you're beating those books and making those great grades to develop your people skills? A lot of us may be shy, and that's not going to get us very far when we want to try to talk to someone at their level about their issues because we don't have the skills. So I invite you to consider the possibility of honing your people skills. In today's environment, you guys have a lot to do, really fast, lots of requirements. See the patient, work with the patient. You have 55 minutes, and then you have to do paperwork, and then you have to see another patient on the 61st minute. That doesn't leave a lot of room for developing that relationship and that compassion and that care. So I invite you to consider how you develop people skills, how you develop the ability to work with other people, especially people who are in need of your care. That's important, working in community. And that transfers to working with partners. Because if you can't, if you don't have the ability to express what you want or what you need or demonstrate some compassion, it makes it very difficult for other people to work with you. And then, can you define your barriers? You are going to have barriers. You're going to have barriers in reaching community. Thank you. You're going to have barriers in people accepting you for who you are. You're going to have all kinds of barriers. So find a partners in your sphere who can help you identify barriers and help you work through what those barriers are. Don't walk away from the barriers. They're there to teach you a lesson. There's a reason they're there, right? They're not the boogeyman. They're the teacher. They're the instructor. They're the barrier to make you better, to stretch you, to expand your mind. So the reason why I say the community is your laboratory is because all of these components are out there. This is really where you will, you've beaten the books, you've made the grades, you've got the letters after your name. Now where do you go? You've got to go into your laboratory, and your laboratory is the community and the people that we serve. Any questions? Am I putting you to sleep? Okay, next steps. Now that I've nattered your head off for 45 minutes, where do we go from here? Well, we ask you to become a member. It's free. You don't have to do anything. What it does is give you access to what's going on. It tells you what's going on. You can write an article and make a contribution. Get your name out there. Get your work out there. Let us know what you're working on. We have a monthly newsletter. It's free. And it's exposure for you. You would be surprised. When we got the Robert Wood Johnson Award, we didn't know that people were looking at us. We didn't know. As a matter of fact, Dr. Natalia, when we got our grant, we didn't know that people were looking at the community. People are looking at you, and you don't even know it. Now, I'm not talking about Big Brother. I am talking about people who really are interested in your work. And your name might show up, come up one day in an article. You ever Googled yourself? You ever seen where you come up? You come up in the strangest places. So be careful what you do out there. I'm not talking about Club 11 or whatever that thing is called. I'm talking about it in real life. But if you become a member, it's just really more access to information. Join a committee. It's free too. Find a home in one of those committees. Go one day. Just come one day to any of them. Our schedule is on the website. Show up. I think Dr. Natalia gave you that. Join a committee. Or just show up at a committee meeting and see if that works. Join the Speakers Bureau. I'm a member of the Speakers Bureau. This is what I'm doing today. I'm speaking about the consortium, but it happens to be in an area where we've worked together with experience that we've had together on projects that might be of interest to you. Whatever you're out there doing, join the Speakers Bureau. It's simple. You fill out a form, and then people come to us and say, do you have anybody who specializes in neonatology or pediatric psychiatry? Oh, yeah, we have one on the Speakers Bureau. They contact you, and then you can go out into the community. Again, excellent exposure for you, and probably not bad for your CV. I'm guessing, right?
Yeah.
Dr. Natalia?
That's right.
Participate in Department of Health community meetings. Those community health improvement plans are enlightening. You get to see what the community wants. You get to see what the community is needing. They're free. They're available. They could be taught, and we announce them on our website. And we if you're a member, we shoot that information out to you to let you know. Those communities also, those meetings also include national and statewide representatives. Again, exposure for you in the work that you're doing. Present at a consortium committee meeting. What are you working on? Are you working on something really interesting? Are you working on something special with the children? What's the mental health projects that you're working? What are the mental health projects? What's your research? Come present to us. Let us know what you're doing. And cross-pollinate. Because just because you're working on children's issues doesn't mean that the people who sit on the Health and the Built Environment Committee can't find a home for your work or can't find that information important and can't pollinate. So you're cross-pollinating when you come to these committee meetings and when you present. We always welcome folks to come and present and talk about what they're doing. And we're going to go back to the bottom line. Partnering with the consortium has been very helpful in getting grants because the consortium is your support base. We are the platform, we are Switzerland, and we can piece that together through the health department because remember, the health department is the mothership of the Consortium for Healthier Miami-Dade. So we've had very successful projects working through the Department of Health. It's a bit was really rigorous the last time we did it, but worth it. So it's a funding opportunity and a partnership that works for everyone. And we wrap this up by saying, you meet the goal. We build a healthy community. We build a healthy environment by creating these partnerships, and ideally on grants. Now, you may have an opportunity for a grant that might need us as a partner. Come to us. Talk to us about it. We are all in to help health. That's the mission of this department. That's the mission of the consortium. And it certainly is the mission of the Miami-Dade County Health Department. So I think that's about it for me. If you would like to make any comments or have any questions, that's the website. I invite you to come on the website, take a look at it, see where you fit, and certainly if you have any questions, I'll be hanging out. Go Canes. Thank you, everyone.
Thank you.